Fareeha Naseer, and I'm from the University of Missouri, Kansas City, the School of Medicine. And I worked on this project with one of my fellow students, Rachel Tao, and my mentors were Dr. Harrison and Dr. Dahl, who are also affiliated with UMKC School of Medicine. We analyzed the rising STI incidence in relation to the 2020 COVID-19 pandemic in the Kansas City area, and we proposed some possible interventions to combat rising incidence. And so what got us initially interested in this was that reported cases of chlamydia, gonorrhea, and syphilis in the United States had been steadily increasing from 2015 to 2019. However, in 2020, there was the COVID-19 pandemic, and from March to May, there was a stay-at-home order issued in Kansas City, and the CDC also recommended avoiding non-essential indoor activities, which included non-essential medical care visits or non-emergent or urgent medical care visits. And so we wondered how that affected care and treatment and maybe rates and incidence of STIs in the Kansas City area. Our thought process was maybe there were the social mitigation efforts had decreased the spread, or maybe possibly a decrease in testing or treatment. And we just wanted to explore that. So our objective was to evaluate the effects of the social mitigation efforts of the COVID-19 pandemic in the Kansas City area on the reported STI rates. And so we were able to obtain monthly and yearly reported case numbers for these three STIs, chlamydia, gonorrhea, and all stages of syphilis from the Kansas City, Missouri Health Department for the years of 2019 to 2022. And the Kansas City Transitional Grant Area, or the Kansas City area, included a bunch of different counties that we all included in our data sets. And so we calculated the monthly and yearly incidence rates by using the current Kansas City census data for those respective years. And then we calculated the percent changes from different time frames as well. And what we found was that even though that there were decrease in monthly incidence rates of STIs during the lockdown, this didn't really reflect in the yearly incidence rates. So we concluded that this may be due to a decrease in testing rather than a true drop in STI rates. And so if you look at the graphs, you can see that there, from March to May, for most of the STIs we looked at, that there was a decrease in the incidence during these months. However, right after these months, and the stay-at-home order had stopped in Kansas City, that there is an increase again. And same on the yearly incidence graph, you can see for chlamydia, gonorrhea, and syphilis that the incidence didn't really change much in our data set. And what we had proposed for some possible interventions in our for future studies was that possibly introducing better curriculum in our UMKC clerkships, where in the internal medicine and the pediatric clerkships, where we are given more educational guidance on STI prevention and how to talk to patients about that. And to implement that during clinics and during our clerkships during that time. And then another thing that we talked about was that we read a study in Canada that had showed that including a workflow order set where you had to opt out. For example, they had, if there were any symptoms relating to urinary concerns, you had to opt out of STI testing in the workflow versus opting in for STI testing in the health like the EMR system. And then another intervention that we talked about and read about was that increasing communication to patients about their results. So in Minnesota, before testing occurred with patients, they asked patients if they would want to receive a text or an app notification through a secure portal about the results. And what it showed was that there was a decrease in test to treatment time. So what that means is that from test to treatment, there was a decrease in number in days. So before it was about 10 to 14 days, but however, after that implementation had decreased about 2 to 3 days, so it decreased to about 6 to 9 days after that implementation. And then a limitation of our study was that we did not have the testing rates of STIs for our Kansas City area only. We did look at testing rates of the whole entire United States. So the testing rates did decrease about 30% between the ages of 14 to 49 in the United States during the COVID-19 pandemic during those months.